Good morning and welcome to Tuesday Tea as part of our Masterful May. So excited to be here with you today. My apologies for getting on a couple minutes late, but we're here and ready to go. Welcome to Illuminate with Dr. Rachel. So Tuesday Tea is truly going to be a herbal medicine talk. So sitting down and enjoying some herbs and talking about their medicinal properties. And I hope that we can have some people on the live feed and be able to have some engagement. So that's really my hope and my desire for this Tuesday tea time is that we'll truly be able to have a whole conversation and chat going on where I can answer your questions about herbal medicine. You can tell me your experiences with the herbs themselves. So all of that will be wonderful, wonderful time of sharing. So on Sunday, I released the herbs that we would be working with, and I'll do that again this coming Sunday. So that way, hopefully for next Tuesday, you can try to have those herbs on hand, at least some of them. They're going to be blends every time. So maybe even if you don't have all of the herbs, you can have a few of the herbs that you can enjoy, and then you can have the experience of them as well. So I have my little tea here, and part of this relaxation time of sitting down and enjoying tea is also going to be about having a sensory experience. So I think that's one of the great things about drinking herbal teas and consuming medicine in this way. And this is a really great way to have an experience with herbal medicine and to take herbs. So lots of people take capsules. Lots of people take tinctures, which tinctures are really great. They're easy to take. They're easy to travel with. They certainly have a really high potency. But when you drink it as a tea, you can have a whole experience with the herbs, which I love. So you can really taste them. You can feel their energy and their essence and all of that too. And that's something that I really came accustomed to when I was studying herbal medicine. So back in naturopathic school, that I was going to naturopathic school in Phoenix, but I was studying with a lot of really wonderful traditional herbalists at that period of time. So both through school and then also just on my own, because I had a really high interest in botanical medicine. I wanted to take it a little bit farther and truly to really become a great herbalist. You have to get out in the field. You have to experience. You have to wildcraft. You have to see the herbs in their habitat and be able to feel their energy and their essence and all those wonderful things too. So today's tea blend is a blend of chamomile, lemon balm, St. John's wort, holy basil, and ginkgo. And I'm going to talk about each one of those herbs individually, and we'll talk about the medicinal properties of each one. And again, I'll be here to answer any questions that you may have. If you're not on the live today and you do have some questions or comments, please leave them on the YouTube channel and on this video, and then I'll get to those and answer those when I'm able to as well. I do want to show you this little herb. So for anybody out there watching, does anybody know what this little leaf is? So this, the other herbs that I'm drinking today, they were dried herbs that I buy in bulk from. I get a lot of my herbs from Mountain Rose Herbs, which is located here in Eugene, and they have really great, high quality, organic, wildcrafted herbs. But this one I'm actually growing myself, and I've been growing myself really since I moved here to Eugene. So I just started a new plant, but at our last house we had a really, really big, happy one of these. So this is lemon balm. So this is what the lemon balm leaf looks like, and tiny little leaves. They get a little bigger than this. My plant is still a baby, so I've seen the leaves, get to maybe even about 3 inches or something on my other plant that was a more mature plant. But they have these really nice silky leaves. Interestingly, you can just eat this straight. My son really likes to just grab one of these little leaves and chew on it because they do have a very lemony flavor to them. So the common name for this is lemon balm, but the scientific name is actually Melissa officinalis. It's wonderful that this plant has a feminine name. So some people do just call it Melissa, which is really sweet. So I love this plant. It has so many wonderful benefits. So I chose it for this tea because it certainly has a lot of uplifting medicinal properties. So it really does help a lot with, I would say that it mostly has a very calming energy to it. So this is something that you actually can even drink before bedtime. It's not like a sedative, hypnotic type herb that's going to put you to sleep, but it does kind of relax the mind and body, which is really wonderful about it. It also is really great for the digestive system as well. So lemon balm is a carminative as well, which carminatives are basically just herbs that the medicinal property that they're pretty soothing to the digestive system in general. So another one of our herbs, chamomile, is also a really well-known carminative. It does a great job. So the carminatives tend to be antispasmodic, so they'll kind of like if you're having like gut spasms or just kind of like upset stomach or indigestion and gas and bloat and things like that. Carminatives are really good for all of that. So lemon balm falls into that category. Another really cool thing about lemon balm is that it's antiviral, and this lemon balm as well as St. John's wort, which we'll talk about in just a minute, they both have a specificity for the herpes virus. So, when you say herpes, most people think of either, the herpes that end up here or somewhere down below. But the herpes family of virus is actually a whole range of viruses. So the Epstein-Barr virus, which commonly causes mono, but is really highly connected to chronic fatigue syndrome and the cytomegalovirus as well, which is another kind of chronic viral infection. And what I've seen especially in Epstein-Barr, is that there can be these recurrent issues with it. So oftentimes people will have mono, and oftentimes people don't know that they have mono because they might just think that they have the flu that, kind of lasted a little longer, was a little more intense than what they've experienced before. But, oftentimes it's mono, and mono comes often in young adults. But I've certainly seen it in children and older adults as well. And so, but this virus is in the herpes family. So lemon balm has a great affinity for the herpes family of virus. And chickenpox is also in the herpes family of viruses. So this is another one that is great for that. And lemon balm, you'll actually find it in a lot of topical products for people who have cold sores. So if you find a natural product that has lemon balm in it for cold sores, it's actually quite effective, both preventatively and if you're in a acute infection as well. So, and St. John's wort works in the same way. So St. John's wort, it also has an effect to all of those viruses that I just talked about in the herpes family, as well as being this really great uplifting herb. But we'll talk more about St. John's wort in just a moment. One other thing I want to just mention about lemon balm is that lemon balm is one of the few herbs that we actually use to treat hyperthyroidism. So sometimes there can be some confusion about the thyroid issue. So hyperthyroidism is overactive thyroid, which is definitely less common than an underactive thyroid, which is actually quite common. And I think I'm actually going to do one of my Wellness Wednesday talks on that because it's so common that I think it's really important to them to discuss. So, but lemon balm does a great job for hyperthyroidism. So hyperthyroidism has more symptoms like heart palpitations or feeling really hot and sweaty. You could also have insomnia and diarrhea. So lemon balm helps directly to settle down that overactivity of the thyroid and also to help with those symptoms specifically. So there is some caution in people who have hypothyroidism with taking lemon balm. I certainly wouldn't recommend somebody who has a significant clinical case of hypothyroidism, especially one that's maybe a little hard to control. Those numbers tend to be all over the place. Probably not a good idea for that person to take lemon balm, at least on a regular basis. If you have it every once in a while or it's in a tea blend, probably no big deal. but probably just not a lot of it on a regular basis. So let's go ahead and talk about St. John's wort, since I already mentioned it. So St. John's wort is really commonly known as a treatment for depression. And in fact, there's been quite a few clinical studies that have shown that it actually works just as well, if not better, because we know there's going to be less side effects and those kind of things, than as a SSRI medication, which is for serotonin uptake. So basically, it helps you to keep your serotonin in your system in circulation. And serotonin is kind of one of our feel-good neurotransmitters. And so the SSRI medications that are often used for depression as well as anxiety, St. John's wort has been found in many clinical studies to perform just as well. So you do have to use some caution with St. John's wort if you are on any of the antidepressive medications, especially those SSRIs. There's something called serotonin syndrome that can happen. And, if you're taking a lot of St. John's wort and you're on an antidepressive medication, you can risk having too much serotonin in your system, and that can really be a life-threatening issue. So most of the time, it's said to not use St. John's wort if you're on an SSRI. Honestly, in a clinical setting, I've used St. John's wort to help people wean off of those medications. But again, that's in a clinical setting where I'm really observing people and checking in with them and making sure. So, so just over the YouTube channel, I'd probably recommend that you don't take St. John's wort if you're on that medication as well. But St. John's wort works really great for this. So helpful with depression, helpful with anxiety. It's a beautiful little plant too. It actually grows quite a bit here in the town that I live in Eugene, Oregon. I've seen it around, and it's kind of it spreads itself pretty wide, and they have these really bright, beautiful yellow flowers. And whenever I think of a plant that's got these big, bright yellow flowers, it really has that uplifting energy and chamomile is the same way, and chamomile is in the Asteraceae family, which is the same as sunflowers, the same family as sunflowers, and they have that big, bright energy always pointing towards the sun. So they certainly have that uplifting energy to them too. And then, as I mentioned, St. John's wort, of course, is a really powerful antiviral, especially for those viruses in the herpes family. Another interesting thing about St. John's wort that it works really great for nerve pain. So St. John's wort, the scientific name for it is Hypericum. There's a homeopathic actually made from St. John's wort that I use often for people who are having really specific nerve pain. And in fact, it's something I use in my surgery protocol with patients. So after surgery, if the pain that they're experiencing is specific nerve pain, which is kind of more of like a shooting pain, I'll prescribe them Hypericum, the homeopathic Hypericum, but I've actually used St. John's wort quite successfully in people who have had nerve injury from past surgeries or from crush injuries and other sorts of things, especially when there's a depressive component within it too, which is pretty common for chronic pain. There is certainly a tie-in with depression, so St. John's wort works really well for that too. Okay, let's talk about chamomile. How are we all doing? So if anybody's out there watching, if you have any questions, again, just a reminder. Oh goodness, what happened? I clicked on a different thing on my computer. As I'm in transition, I just want to take a minute to apologize. So this, my YouTube channel is new. I'm doing all of these things for the first time. I was hoping to be able to record all of these live YouTube videos from either my phone or my iPad, but then found out that you have to have 1,000 subscribers on your YouTube channel in order to go live on a device. So I'm having to go live from a rather old laptop that doesn't have a very good camera. So, I'm noticing the video qualities and the resolution of these videos aren't as great as I would like them to be. So, my apologies on the video, but, for all of you out there watching, make sure that you subscribe because as soon as I get to those 1,000 subscribers, I can certainly have a little better quality videos, which I'm looking forward to. So be sure, if you're enjoying this information to share, to subscribe, and we'll keep moving forward on things together. Okay, I'm going to take a couple more sips of my tea, and we'll have a little transition from all of the information. So, this tea has a wonderful quality to it. It's quite rich in flavor. There's definitely a lot of floral notes, a lot of lemony notes to it too. So that's coming from the chamomile. The chamomile has that very floral note to it. The St. John's wort has a little bit more of a mellow, kind of more earthy, leafy taste to it. So not a really strong, potent taste from the St. John's wort, but I definitely taste the chamomile notes coming through. I definitely taste those lemon balm notes coming through, and then the holy basil. Has almost like a little sweetness to it, and then the ginkgo I would say has a little bit more of that earthiness to it. But it's a really great blend of tea altogether. So I think I might start putting this blend of tea together too. I have an Etsy shop. And on my Etsy shop, I've sold some tea blends together, and I have a tummy tea and a sleep tea, and I'm really enjoying this uplift tea. So this may be one that I also start selling on Etsy. So I'll keep you tuned into that if I decide to do that. Okay, let's talk about chamomile. So chamomile is its common name. Its scientific name is Matricaria repudia. So Matricaria, this is like it's in reference to the mother. So this has this divine feminine, this divine mother energy to it, and I have a great connection to chamomile as well. I used to grow it when I lived in Arizona. I haven't grown it here since I moved to the Pacific Northwest, but it does grow really well here as well. So lemon balm, St. John's wort, and chamomile all grow well here in the Pacific Northwest. But my garden in Arizona, I grew lots of chamomile, and they were so sweet to see those little. So, if you've seen chamomile before, it has this little yellow ball and little white flowers that come out. And sometimes it won't have the white petals on it. So when there's a lot of it, sometimes they don't have the little white petals on it, but it'll just be the little yellow ball in the middle, which is really cute to see too. But I've done a lot of wildcrafting of the chamomile, both in my own garden and then my naturopathic school that I went to actually grew chamomile as well. So one of the big herbal medicine, botanical medicine conferences that they have at my school, which was always in April, which of course was gorgeous, sunny, wonderful in Phoenix, Arizona, and there was a class that I took where we wildcrafted some of the chamomile, and then we actually made a flower essence with the chamomile. So one difference that you do with when you're making flower essences is you pick a lot of the flower, you put it in a big bowl, cover it in water, and then you usually leave it out in the sunlight, or oftentimes people will leave it out in the moonlight. So I know a lot of people that make flower essences will leave them out when it's a full moon or something like that, or a full super moon. Or I know some people who made a lot of flower essences during the eclipse that we had a couple of years ago. And so, that's the flower essences are basically like a homeopathic. So you're wanting them to absorb a certain type of energy. So when we were taught to make this flower essence with chamomile, our instructor didn't want us to actually touch them and put our own energy into the flowers. So we had to kind of like pop them off at the top. So it was kind of, it was very reminiscent of childhood. I grew up in Ohio. And so I remember when I was a child, we used to like pop the tops of dandelion heads off. So it was very reminiscent of that, popping those little chamomile heads off. So that was a great way it's a great use of chamomile as well. But chamomile, of course, is a really great soothing tea. I think chamomile has this great affinity for children as well. And so you can use it even with babies. It works great for teething. It's got some anti-inflammatory and anodyne, which means like a natural painkiller. So it's great for children. It's very gentle but very effective. So when my boys have been teething, I'll make a really strong chamomile tea, and I'll soak some either gauze pads or a little thin little cloth in the chamomile, and then actually freeze them. And then I pull those out and I let them just kind of suck and chew on that. You can give chamomile tea to to babies and to little kids. So you don't want to give any tea or really any water or anything to babies under the age of 6 months, and certainly never putting any honey or anything in it. But you can. I've given chamomile tea to my babies when they've been over 6 months, and then even as toddlers, it's something that they enjoy to drink too, because it does have a really sweetness to it, and really kind of helps pacify them. I think it really helps to relax them, and certainly helps with teething pain too. Chamomile also is a homeopathic, and it's one of the homeopathics that we use often in teething babies that helps tremendously. So even if you find one of those combination homeopathics that have different homeopathics in it, and it's marketed for teething babies, it'll always have chamomile in it. And chamomile homeopathic gets used in adults too. And one of the keynotes is that there's this very kind of like what's called peevish energy. So it's kind of like a little like immaturity, or a little child, kind of like a childish peevishness. So not like childlike nature in a good way, that you're like free spirited and thing, but that you have a tendency to just kind of be whiny and things like that. Chamomile works, the homeopathic works well for those things. Chamomile is incredibly soothing to the gut. So I already kind of mentioned it earlier. That it's a carminative, so it helps with spasms in the digestive tract. It helps with cramping and indigestion, and having good regular bowel movements. Tends to be just really relaxing and soothing in general. Is also a really great tea to drink before bedtime, but has this sweetness to it, and it all comes. If you look at a chamomile flower, you can just see that again, that uplifting nature, that coming up towards the sun. So it works really great for all of those things. I think I mentioned earlier too that it's in the Asteraceae family. So some people do have a sensitivity to the Asteraceae family herbs. So there can be like a dermatitis, which is like a skin inflammation or skin rash that can happen if you're allergic to the Asteraceae family of herbs. So some caution in that when you're consuming chamomile. I just remembered another cautionary one with St. John's wort that I forgot to mention. If you're taking a lot of St. John's wort, there also can be some risk with photosensitivity. So you have to, if you're taking especially really high doses of St. John's wort, again, if we're talking about, like you're just drinking the tea every once in a while or something like that, you don't really run into that problem. But if you're taking higher potency of St. John's wort, which is, a higher dosage is definitely needed when you're, treating depression, mild to moderate depression. You'd want to take a little higher dosing of that, and you would need to be a little careful with photosensitivity. So being out in the sun, because you can get that, you can get rashes and things from taking it. Okay. One more little tidbit about chamomile that I love. This is another really great treatment for kids and babies. Chamomile is really, it's very anti-inflammatory, as I mentioned. It's also very antimicrobial, and it works really well for conjunctivitis. So there's different types of conjunctivitis. There's a bacterial conjunctivitis, which is often caused by E. coli, and it's usually a fecal contamination. So in little kids, what happens when they are exploring their bodies, or they're first learning to go to the bathroom on their own and wipe, and maybe don't do a great job of washing their hands and then touch their eyes. That's oftentimes when that bacterial conjunctivitis, which that one's a little bit more serious. Chamomile, if you catch it early and the symptoms aren't too bad, chamomile is going to have some efficacy for it. But I think it works. It definitely works if it's a more mild case, or if you kind of catch it early, or both, hopefully. And then there's things like viral conjunctivitis, and then also, in babies, they often get blockages in their tear ducts, and you might just see, some goopiness under their eyes and things like that when those tear ducts get blocked. But I love to use chamomile in a very similar way to the teething, except that we don't freeze it. And so you would again soak a cloth in a really nice strong chamomile tea. Some people will even just get a normal tea bag of chamomile and put that on, let it soak in hot water first, let it cool off a little bit. You certainly don't want to put something really hot over your eye. So you want it to be warm, but not hot. And then you would put that compress over the eye, make sure that some of that strong chamomile tea actually will get in and around the eye. And it does a really great job for conjunctivitis. So I think that's another just nice little home remedy that's good to know. Okay, next we'll talk about holy basil, Tulsi. So Tulsi, holy basil, is an Ayurvedic herb, and I love my Ayurvedic herbs. I think they're wonderful. I think most of the Ayurvedic herbs are really great at helping with just longevity and our essence, and fall into that regenerative medicine, anti-aging medicine kind of thing. And holy basil is in the family of herbs that are adaptogens. So the adaptogens really work on the adrenal system. So they do a lot of regulation in the adrenal system. So they can help with sleep, they can help with energy, they can help with the immune system. So holy basil certainly does all of that. Holy basil also has some antimicrobial properties. And I find holy basil to be just one of our really well balanced, really soothing adaptogens. So some of the adaptogens can be a little energizing. They can be a little intense sometimes, and sometimes that's what's needed. But holy basil is just one that is really, really calming and really sweet. And so this is actually one that we'll often use in nursing mothers who are maybe struggling with just their energy, or having trouble with sleep, having trouble with anxiety, and they're breastfeeding, and it's so hard to know what you can and can't take when you're breastfeeding and when you're pregnant. But holy basil is one that's really wonderful and very safe to take. So I use it often for things like that. So holy basil just it has a really great sweetness to it. And I'm forgetting the translation in Ayurveda right now. I was trying to find some of my Ayurvedic notes before this so I could remember what it was. But the translation of holy basil Tulsi has something to do with Brahma, which in Hinduism there's kind of the three main deities, and so Brahma is kind of this like creator energy. So there's a lot of really strong traditional medicine components of holy basil and its tie-in. And then our last herb we have to talk about here in our uplifting tea is ginkgo. Ginkgo is the common name, and ginkgo biloba is the scientific name. And so anti-inflammatory, antioxidant, works as a tonic, works as a neurotrophic, which means that it works in the brain, it works with the neurotransmitters. I included ginkgo because it has this very nice uplifting energy to it. And medicinally, one of the things we use ginkgo for really effectively, and again, there's some really great research with this, is that it could be very helpful with both the prevention and treatment of cognitive decline. So this is things like Alzheimer's, and even some of those like neurodegenerative disorders like Parkinson's and things that have to do with your neurotransmitters and all of those things. And macular degeneration, which is another thing that we think about as being a degenerative type disease. And I think one of the reasons that ginkgo works so well for it is that it's so rich in antioxidants, but it also has this great effect on the circulatory system. So it actually has some antiplatelet properties to it. So it can help for people who form clots and things like that, to prevent clots. Certainly you'd want to use caution with this and probably avoid it altogether if you were on some type of anti-clotting medication, because it's gonna thin the blood out too much. So that is one reason not to take ginkgo. But so if you are, if you have some Alzheimer's that runs in your family, or if that's just something that's been a concern of you, for you, ginkgo can be a great thing to add in. I also like to use it for people who have that, like I said, macular degeneration or have breakdown of the eyes. So rich in antioxidants, so rich in helping with the circulatory system. And one of the reasons that it helps with helps with the cognitive function is because it helps with the circulation to the brain. So it's actually great treatment for things like migraines that have, especially migraines that are related to circulation. So it helps to increase that blood flow to the brain. So I included the ginkgo in this one because it does have that uplifting energy because it makes you feel more awake and alert without, having actually caffeine in it. Helps with the circulation to the brain. Helps with neurotransmitter balance in general too. So all of that is going to help tremendously. Um, so this is kind of mental emotional health week, which I think is a really pertinent topic with what we have going on. So if you watch this playback, later on, if you're from the future looking back, we're going through this COVID-19 pandemic right now and going through stay-at-home orders, and it's been a really challenging time for a lot of people. There's been a lot of economic loss, a lot of job loss, a lot of stress for people as the world is changing very, very rapidly. And so, mental emotional health disorders are really increasing right now, and it's something that we're really having to keep an eye on. So I really wanted to spend some time talking about all of that this week, which we're going to go into it in greater detail tomorrow with my Wellness Wednesday talk, which is going to be dedicated on mental emotional health. So we're going to talk lots about neurotransmitters, natural therapeutics for mental and emotional health, for anxiety and depression and all of those things. The meditation we did yesterday was one. Also just has this, mantra meditation in general is really purifying and helps tremendously with just mental emotional health too. And then of course our uplifting tea that we're discussing today. So we're going to kind of link everything in together. So I hope that you can tune in tomorrow for the Wellness Wednesday talk on mental emotional health. I hope that you enjoyed this little herbal medicine talk. I love herbal medicine. I'm really passionate about herbs. One of the wonderful things is that, every herb has so many properties to it. It's not just like, oh, lemon balm is only good for this. It's like lemon balm is good for so many things. And the herbs, when you consume them together, they have a tendency to work really synergistically with each other, which is another thing that I really, really love about them too. So just in summary, chamomile, lemon balm, St. John's wort, holy basil, ginkgo were the 5 herbs that we discussed today as the uplifting tea blends. I welcome your questions and your feedback. Just a reminder again to subscribe to the channel. If nothing else, it's going to help me to be able to use my devices so I can have a little better video quality. But I'm happy to be here sharing information with you right now. And the whole purpose of this Illuminate with Dr. Rachel channel is to really give you good quality information about topics in the health and wellness realm. There's so much information out there. There's so much misinformation right now out there, and especially right now, nobody really knows what to believe or what to do about everything that's going on. So I hope that I can just shed some light on your health and wellness concerns, and that we can have good, honest, authentic talks on this forum as well. So I hope you have a wonderful rest of the day. Thanks for being here for Tuesday Tea. Bye.